Finals SAQ 92 Coeliac Plexus Block. A. Describe the anatomy of the coeliac plexus. The coeliac plexus is a bilateral structure made up of preganglionic sympathetic fibers from the greater splanchnic T5 to T10, lesser splanchnic T10 to T11, and least splanchnic T11 to T12 nerves. It comprises the coeliac, aorticorenal, and superior mesenteric ganglia. It is a complex neural structure encompassing afferent and efferent neural constituents, also supplemented by parasympathetic fibers primarily from the vagus. The nerves coalesce anteriorly to the body of T12 before entering the abdomen posterior to the diaphragmatic crura. It supplies the liver, gallbladder, stomach, pancreas, spleen, kidneys, small intestines, and the first two-thirds of the large intestine. Functions includes GI function, regulating digestive enzyme secretion, modulating GI motility, and orchestrating blood perfusion, vascular regulation through regulating blood vasoconstriction and dilation, and pain perception, conduit for transmitting visceral pain signals from the abdominal organs to the CNS. The coeliac plexus is retroperitoneal, anterolateral to the body of L1 bilaterally, anterior to the aorta and crura of the diaphragm, on either side of the origin of the coeliac artery, medial to the inferior vena cava, and posterior to the stomach and pancreas. B. What are the indications for coeliac plexus block? The coeliac plexus supplies the liver, gallbladder, spleen, stomach, pancreas, kidneys, adrenals, small intestines, and large intestine proximal to the splenic flexure. Any cause of intractable pain involving these organs can be managed with coeliac plexus block, such as pancreatic cancer pain, stomach cancer pain, and chronic pancreatitis pain. In theory, coeliac plexus block can be used for upper abdominal surgery, but this is not done as there are superior alternatives with lower risk. C. List the anatomical approaches used for coeliac plexus block. This includes the retrocrural approach, or classic coeliac plexus block. This is commonly performed with fluoroscopy or CT guidance at the L1 level in prone position. Next is the transcrural approach. The needle is advanced through the diaphragmatic crura, and the tip is positioned on each side of the anterior aspect of the aorta with CT guidance, or the needle is advanced through the aorta with fluoroscopic guidance, i.e. transaortic approach. Next is the anterocrural approach. This was described initially using anatomical landmarks, and then later with CT and ultrasound guidance. D. Which specific complications are associated with coeliac plexus block? This includes pneumothorax, chylothorax, retroperitoneal bleeding due to aorta or IVC injury, intravascular injection into great vessel, visceral puncture, damage, abscess or cyst formation, hypotension due to dilation of upper abdominal vessels, thrombosis, intrathecal or epidural injection, paraplegia secondary to phenol injection into the arterial supply of the spinal cord, direct spinal cord or nerve root damage, retrocrural spread of phenol causing spinal nerve root damage, sexual dysfunction, and injection into psoas muscle with risk of cyst or abscess formation. 36.4% pass rate. Additional information: sympathetic blocks. The sympathetic nervous system is a part of the autonomic nervous system that controls the body's involuntary activities. It has been implicated in neuropathic pain, vascular, and visceral pain. Sympathetic ganglia has been the target of local anesthetic blocks to assess the role of sympathetic nervous system in transmission of pain. Despite the frequent use of minimally invasive sympathetic blocks by pain practitioners, their efficacy for providing analgesia has been sparsely reported. Rationale for the use of sympathetic blocks. For vascular pain, the origins of vascular pain are complex. Pain can come from arteries, dysfunction of microcirculation, or from veins. Sympathetic block using percutaneous techniques or by continuous infusion can improve circulation and relieve pain. Neuropathic pain is often multifactorial, with sympathetic nervous system as one of the several causes. Sympathetically mediated neuropathic pain may not be fully relieved by sympathetic blocks. However, some improvement may occur. Adjuvant therapy is often needed, such as opioids, anticonvulsants, antidepressants, physiotherapy, neuromodulation, and psychological strategies. Indications for sympathetic blocks: peripheral vascular disease, visceral pain, hyperhidrosis, and neuropathic pain. Peripheral vascular disease, such as acute vascular disorders, post-traumatic vasospasm, acute arterial or venous occlusion, cold injury, inadvertent intra-arterial injection of irritants such as thiopental or contaminated drugs of abuse. Chronic vasospastic conditions such as Raynaud syndrome, acrocyanosis, livedo reticularis, and sequelae of spinal cord injury or polio. Chronic obliterative arterial diseases such as thromboangiitis obliterans and atherosclerosis, and perioperative such as microvascular surgery and AV fistula formation. Visceral pain indications includes upper abdominal cancers, rectal tenesmus of cancer, chronic pancreatitis, chronic perineal cancer, some chronic non-cancer pelvic pain syndromes, cardiac pain such as acute myocardial infarction and refractory angina, and perioperative pain such as from upper abdominal surgery. Neuropathic pain such as acute herpes zoster, carcinomatous neuropathy, and complex regional pain syndromes can be treated with sympathetic blocks. Contraindications for sympathetic blocks includes patient refusal, coagulopathy, local infection or cancer, anatomical or vascular anomalies, and hypovolemia. Setting: the blocks must be performed aseptically with adequate facilities for resuscitation. Radiographic guidance for the procedures and ability to save images must be available, especially with neurolytic blocks. Performance of blocks can be uncomfortable. Sedation can be given in addition to infiltration with LA. GA is rarely necessary. Nerve damage can go unrecognized in patients undergoing GA due to inability to speak or respond. Patients must be carefully monitored during and after the procedure. Types of sympathetic blocks includes diagnostic blocks, prognostic blocks, and therapeutic blocks. Diagnostic blocks are used to assess the sympathetic component of pain. Prognostic blocks are used to try to test the effect of the block on pain, blood flow, or sweating, but there may be poor correlation between the prognostic block and outcome of any subsequent surgical or neuroablative procedure. Therapeutic blocks may be performed with LA, neurolytic chemicals such as phenol or alcohol, neuroablative techniques such as RF lesioning, or with drugs such as guanidine or bretylium in IV regional techniques. Drugs and techniques. LA may be used for diagnostic, prognostic, and therapeutic blocks. Lidocaine 1% is used for diagnostic block, bupivacaine 0.25 to 0.5% or similar for other blocks. Neurolytic solutions are used for therapeutic blocks. Options includes phenol and alcohol. Drugs used for IV regional block of sympathetic nervous system includes guanidine, which is most commonly used. Other options includes ketanserin, bretylium, labetalol, ketorolac, hydralazine, mitaldopa, pentolamine, clonidine, and droperidol. Systemic block of sympathetic nervous system can be used with pentolamine, pamidronate, prazosin, phenoxybenzamine, nifedipine, and clonidine. Radiofrequency technique may be used to ablate parts of the sympathetic nervous system. Examples of sympathetic blocks: sphenopalatine ganglion block. Indications includes Sluder's neuralgia, cluster headaches, migraine, atypical facial pain. Side effects: epistaxis, paresthesia of teeth and hard palate. Stellate ganglion block. Indications includes pain affecting upper limb and thorax, and vascular insufficiency. Side effects includes Horner syndrome, nerve injury, such as brachial plexus, recurrent laryngeal nerve, and phrenic nerve, perforation of trachea or esophagus, inadvertent vascular or intrathecal injection, and pneumothorax. Thoracic sympathetic chain block. Indications includes cancer and rarely non-cancer pain of abdomen, thorax, head, and neck. Side effects includes pneumothorax and vascular trauma. Coeliac plexus block. Indications includes pain of upper abdominal cancers and rarely in chronic pancreatitis. Side effects includes bleeding, retroperitoneal hematoma, intravascular injection, intrathecal or epidural injection, perforation of nearby viscera, pneumothorax, chylothorax, infection, hypotension, diarrhea, impotence, paraplegia, lower extremity warmth, thrombosis or embolism. Lumbar sympathetic block indications includes vascular insufficiency, CRPS, neuropathic lower limb pain, cancer pain, rectal tenesmus from cancer, and intractable back pain. Side effects includes bleeding, intravascular injection, intrathecal or epidural injection, perforation of viscera, and groin pain. Superior hypogastric plexus block indication includes cancer and non-cancer pelvic pain. Side effects includes visceral trauma, bleeding, bladder or rectal dysfunction, and erectile dysfunction. Ganglion of Impar block. This is for perineal pain and coccydynia. Side effects includes visceral trauma, bleeding, bladder, rectal and erectile dysfunction. The technique for these blocks are included here for completion. These are my references. Thank you.